I started thinking about being a doctor when I was, I think, probably 14 or 15. And I never thought of anything else after that.
As a kid, maybe a little bit different. I always liked going to the doctor's office because I felt that Dr. Walker, my pediatrician, would always take such good care of me. And I think that was probably maybe when I was 5 years old or so, was when I first started thinking I was going to be a doctor.
I come from a family of dentists. And so after my dental school, I did an internship in a hospital in New York. And we spent every third night in the emergency department. And that is what first piqued my interest in emergency medicine.
I'm not the kind of person that know that I want to be a doctor when I was 8 years old. And when I was doing research at the National Cancer Institute, and so I decided to enter medical school.
When I was in training, one of the physicians that trained me said, David, something always to remember, good enough isn't. If what I can do as a physician is not only care for that child, but to tell that mother, I will care for your child as if it were my own, that gives that mother everything that she needs.
It's about relationship, not about facility or testing. Of course, we have a beautiful facility here, and we have all the resources that we need, but in the end, it's about the time that you take to talk to patients, to really understand them, to understand what their needs are, to teach them about their body.
My mother is a nurse. She says, when you become a doctor, you have to remember your time is not yours again. Patients want to see you, see your face, even just a few minutes. So I think it comes both ways.
We have 4 adopted children from China, so they have medical needs. And we spent a lot of time in hospitals here in China and lots of time in hospitals in the US. So you learn to appreciate doctors that take the time and nurses that take the time with you and explain things. As a parent, your stress and anxiety is decreased. Your children are better off because they don't sense the stress and anxiety from you, and so they do better and they thrive and they get well better and quicker. To me, it's rewarding and makes me encouraged to continue doing the job when you can work with that child and the parent, because the parents are also anxious, and set them at ease, make them comfortable, yet complete the procedure successfully.
Being a physician, and particularly being an anesthesiologist in the operating room, I have never been more alive than in those circumstances.
My patients in my previous institution, I feel like they see me as a friend, they see me as a family member, a confidant. I think lots of times the patients might even tell me something before they tell their husband sometimes. They feel like you're part of the family, and I feel like that's really a gift, because normally we just have our own family, but I have hundreds of families, I feel like.
And I actually had patient request me to say, I will bring my kids in and you're going to tell them I'm going to be okay. And I think that's just so rewarding. They just trust you so much, And I think that trust, is really most precious for me.
You'll never be more alive than when you see a single ECG displacement on a screen. And you wait, and you wait, and then there's another. I've lived my life in the interval between 2 heartbeats.
Not all the time, but I think overall I do that relatively well. And so that's something that kind of keeps me going.